Congratulations, first of all, on winning the 2021 Horwitz Prize.
Oh, thank you.
Oh, thank you very much. I am so honored.
It's such an honor to have you speaking to us today. When you were developing the vaccines, did you imagine they would be used in such a crucial and historic situation for the first time?
Obviously not. And as you might know, that I want to develop the messenger RNA for coding for therapeutic protein. And of course, I became known now, but I wish that there would be no pandemic, and then I would be just an unknown person and other scientists working in the laboratory.
I thought that they would probably be used for an influenza pandemic, because we have those not often, but often enough. And I knew that the platform had enormous potential for reacting quickly. I didn't expect a coronavirus pandemic like this.
And what was the biggest challenge, in those years leading up to this moment? What was your biggest challenge in developing the mRNA vaccines?
Yeah, everything was a challenge. So we couldn't get grants. When we wrote papers, people really didn't care about it. When we went to meetings, people said, yeah, nice data, and didn't really care. They all came back and said, yeah, RNA is too hard to work with. We're not interested in RNA. So we kept getting brushed off, but we never gave up because we knew it had enormous potential.
All these years, I submitted a grant application for RNA, messenger RNA for therapy, and I did not get the money, but it seemed that, when we were doing the experiment, we could see that we are getting better and better results. And so that was the reason. And so even, we didn't get support from outside, but we were very enthusiastic.
Absolutely. And we're so glad that you were. Why do you think people were skeptical? Was it just the difficulty of the nature of RNA as a molecule, right? It being fragile, you never get it to evade the immune system, these sort of things?
Yeah. So, in people's hands, the RNA was really inflammatory and it was hard to work with. So if you injected RNA into an animal before we figured out how to make it non-inflammatory, the animals got sick. But when you're making a vaccine, if the vaccine makes you sick, that doesn't do you much good. So it was really that 2005 paper where we showed how to make it non-inflammatory. But by that point, people had been working with RNA. They knew it was difficult to work with. They knew it was inflammatory. They didn't, really notice our work. And it just took a while for people to figure it out.
One reason was, of course, because in the 90s, it was, the Human Genome Project started and everything was about gene therapy. So as recently I wrote, the messenger RNA therapy was in the shadow of the gene therapy, the DN. The people were rejecting our application because concerned about how labile. Now, today, we can say that how good that we are not doing for long time, making this spike protein. We don't need that. We just need 1-2 days, just enough for the immune system to recognize. So it is a benefit.
What was the inspiration behind solving that inflammatory problem? I know, you're substituting a specific tRNA out, right? What led you to that point of thinking that was the solution?
Yeah, it was really years of work. So Katie had been working on RNA for a few years before I got to Penn. And she was getting nowhere because the animals died when she injected RNA into them. But when I started working with her, I noticed that the RNA was inflammatory. And that made us start to think about, why is it inflammatory? What are the receptors? What are the mechanisms? We spent a few years figuring that out. And then we came up with the hypothesis that if we modified the nucleosides, we could get rid of that inflammation. And when we tested it, it was correct. And that's how we made our observation. We knew it was inflammatory. We had to figure out how to make it non-inflammatory. and safe to deliver.
I might mention, that there are 108 different modifications there. And when we made we could purchase 10 different ones, and only 5 of them incorporated to the RNA. So we crossed our finger to make sure that whatever was important must be in that one out of the 180.
Oh, wow.
108 different modifications. And we expected that we hoped for that which is critical to suppress immunogenicity will be present in those final 5.
That's amazing. It's great when that works out. It's always nerve-wracking when you do those experiments, right? Maybe rewind a bit and tell me, I think there's a story about a photocopier, somewhere, meeting at a photocopier I read. How did you meet Dr. Karikó, and how did you first work together?
Yeah, so it's a true story. And younger researchers don't realize this because they don't know what a photocopier is. But back then, the only way you could read a journal was to photocopy it. So we would, it was a friendly fight. Whoever got there first got to use it first, then the other had to wait. But we started talking, and we were looking for ways of making new vaccines. RNA had been tried before, and Katie had the RNA, so we tried it and we started working together.
That's amazing. So what you're saying is Zoom meetings might be great, but there are still reasons to work in person after all of this is over, right?
Exactly. That coffee machines to hang out by and talk are still important in life in general.
I would love to hear, what was your reaction when you first saw the amazing efficacy numbers from these experiments on the vaccines?
Maybe I am naive. Maybe I don't have enough knowledge on that, but I kind of expected that, because we have already seen before, as I told you, 2017, that every viral target, when was used in different animal models, including monkeys, it was always very protective. And of course, we have seen from the phase 1/2 trial, we could see the high level of antibody. We could see, cellular immune response. So it was kind of obvious. By celebrating, I will eat the whole, box of Goober's chocolate, which was made in Philadelphia. It is
yes, of course.
100 years ago in Philadelphia, they generated this Goober's chocolate. But usually I don't eat the whole box, which is like not that much of the whole box. It is a movie theater box.
Yep.
But that was, that I ate all of the. So that was it. And of course, I'm not celebrating really until really that everybody will be safe and this pandemic will end, and then maybe I can more relax. But that is very important.
I was very nervous when this data was getting ready to come out. And that's because my lab has been working on vaccines for a lot of years. We've probably developed 30 different vaccines. And what we saw with just about every one of them, when we tested them in animals, we usually had 100% efficacy. The animals were always protected from infection. So we were really nervous because my fear was that in humans with COVID-19, what if we see 50% efficacy? The FDA, the WHO would accept that, but we're used to seeing 100%. So I was really nervous that humans are always different than mice. That's just how things are. So we were very excited, or relieved, I should say, when we saw 95% efficacy.
Yeah, that's interesting because I spoke to Dr. Karikó the other day. She was confident, apparently. So it's interesting that you had different perspectives on this. How did it feel for you when you first got the first vaccine, something that you worked years to create? What was that moment like?
Yeah, so Katie and I got immunized together. It was exciting because we spent 23 years working on RNA, and the hope is always someday something you work on will go into people, and now it was going into us. So that was a great feeling.
It's such an emotional experience for us. It was for me. And I hear so many of my friends as well, you know, that moment of crying. And I think in New York, it's like, we like our events. It's like the biggest event because you can't do anything else. The biggest event in town is getting your vaccine appointment, then going to do it. And people get dressed up and they, you know, they cry. It's just, I hear so many stories. Yeah, taking pictures. Like, how does it make you feel when you see that reaction to people have to something that you worked on for so long? How do you feel about that?
So it was very emotional, and I got a lot of letters from people who get, and you know, healthcare workers at the beginning that because they are the real heroes who went to work, the doctors, the nurses, the cleaning personnel that went to the room where patients with this disease, with this corona, were there, and they were taking care of them and risking their own life. You know, going home and not knowing that, and separated from their family, just to make sure that they are not infecting them. So for them, it was very important. And a lot of people who, you know, couldn't see their parents because everybody tried to be isolated, and that, you know, happiness that they could get the vaccine and it was, you know, and they want to express to somebody, and they emailed me or sent me cards. And so it was very nice. And of course, you know, I know that so many people, as I just mentioned, so many people worked on it. And before, those people who came before us and our colleagues, and later, not mentioning not just the scientists at BioNTech or Moderna, but all of the technical expertise, you know, who scaled up this production and figure out how to run the clinical trial, how to run, you know, the shipping the sample, distributing everything. So it is just a superb job from everybody who participated. And I am just happy that I am one of those persons that contributed to the success.
Are you worried about variants at the moment in terms of efficacy? And is there a like sort of need to, you know, roll this out and solve all of these logistical scientific problems on a worldwide scale right now, because there are variants out there and so many people have, you know, the virus at the moment?
Yeah, so, you know, that's exactly the problem, is that until we vaccinate the entire world, variants are going to keep appearing. So far, all of the variants, the RNA vaccines work very well against. The fear is that someday variants are going to start appearing that the vaccines don't work against. Now, because of the speed of RNA vaccines, we can make a new one. We can make a booster very quickly. But, you know, I really hate having to chase after this virus for the next 5 years, keep making new variant vaccines. So the most important thing is to vaccinate the world. The other thing is that what we've been doing since last spring, we've been working on a pan-coronavirus vaccine. There have been 3 coronavirus epidemics in the past 20 years. You have to assume there's going to be more. So we can do what we did this time, and that's work quickly and make a vaccine, but that still shuts the world down for a year and a half. So what we started is making a vaccine that would work against any coronavirus that crosses over from bats or pangolins or civets or any other animal, camels, so that the vaccine is ready to go, or even better, is given to people now that'll prevent the next COVID-19 or COVID-22 or 25 or whenever it appears, so that we can prevent it before it happens. I think that's what's critical, because, you know, responding quickly is good, but it's, you know, look at the world. We made a vaccine in 10 months, but the world has been shut down for a year and a half. If we can avoid that, I think that's critical.
And I'd like to end with a couple of, I guess, personal questions about your career. What inspired you to become a scientist in the first place? And when you started your career, could you ever imagine working on such a historic problem in 2021?
Yeah, so, you know, I got interested in basic science when I was in college. And I actually did a master's degree to get more exposure to basic science as part of my bachelor's degree. After that, I did an MD PhD because I knew I was interested in research. When I did my fellowship, so after residency training, I went to Tony Fauci's lab, and that's back when HIV was just being discovered. So, I started this out in a brand new epidemic, trying to understand what that epidemic was, trying to develop the immunology and ultimately develop vaccines that we're still working on. So I started out in a brand new epidemic. I'm not surprised that the end of my career is going to be a part of a big pandemic as well.
I think something that we see is that many of the previous Nobel Prize winners are immigrants, and I think we think it's really important in science. Why do you think immigrants and a diversity of ideas are so important for, good science and good scientific ideas?
The people are, when myself in 1985, I flew with my 2.5-year-old daughter and husband to the US. We had no cell phone, there were no credit card, and there was nobody to ask help because we didn't know anybody in the United States. When an immigrant person is coming, you have to believe so much that you will come over all of the problem. You have to believe so much in yourself to come here and with no money and nothing, and you have to believe that you can do it, and also that you are coming up with always solutions. So I'm so used to in Hungary that, okay, we don't have something, okay, that we don't have chemicals. I can make it, how to make, look it up, and always that kind of solving instantly a situation, and not like, oh, back ordered, it will come later. No, that we can do it, and always you have to adopt. That situation is changing, and that's what makes you viable here.
And one last question I have before we can wrap this up. I've read that you said you've fulfilled your dream in science because you've created something that helps a lot of people, right? So what now? What's next for you?
I think that the scientist is similar to those rock band players. They are playing. There are always somebody listening until they drop dead on the stage, and that's it. You don't see that rock player going to retirement because they enjoy making music. I enjoy making science.
Yeah, you can't retire from something you love. Impossible, right? I love that. Well, thank you so much for your time, and congratulations on winning the 2021 Horwitz Prize. We cannot thank you enough for your contributions to science and the world at the moment. So, really appreciate you.
Thank you. Thank you very much for, I remember reading once in Hungary about this prize, and reading all of these prestigious people, all of this knowledge, and to think about that I will be in their company. I mean, I am so honored and very, very happy. Thank you very much.